Thank you. This is Dr. Priyanka Di, Dr. Daisy Ba, and Dr. Anjit Da. I had
We had a great time.
Yeah, we had a great time, and I was posted in Dermatology. And thank you, Ba, for inviting me. Okay, subscribe कर देना मेरे channel.
Subscribe, like, subscribe.
Thank you. Clicking session is going on. Guys, फिर से आप सभी को मेरी YouTube के चैनल पे स्वागत है। तो चलिए आज मैं दिखाऊंगी एक
pigment here. And how do you know it is not melasma? Simply look at the rim of the ear. Rim of the ears are 99% involved if it is hair dye-induced pigment.
इससे पहले वाली वीडियो में कि मैंने बहुत सारा वीडियोस बनाया है मगर अपलोड करने को टाइम नहीं मिल रहा है, तो आज की इस वीडियोस में मैं आप लोगों को दिखाऊंगी CME। तो CME मतलब क्या है वो मैं आप लोगों को बता दूं। सबसे पहले CME मतलब कंटिन्यूइंग मेडिकल एजुकेशन, मतलब जो हम लोग सीखते हैं साल भर मेडिकल कॉलेजेस में उसको ही मतलब कंटिन्यू करते हैं। कुछ ऐसा मतलब बड़े बड़े लोगों को बुलाते हैं, बड़े बड़े डॉक्टर्स को बुलाते हैं मुंबई से, दिल्ली से, दूसरे जगह से, अदर पार्ट्स ऑफ द कंट्री या फिर आउट ऑफ द कंट्री, ऐसे लोगों को बुलाते हैं ताकि मतलब नॉलेज को हम लोग इंक्रीज कर सकते हैं। जो ऑनगोइंग मेडिकल एजुकेशन है उसके बारे में डिस्कशन होता है, फिर क्वेश्चंस पूछा जाता है, फिर उन लोग आंसर जवाब देते हैं। बहुत अच्छे से पढ़ाया है सर ने। तो चलिए देखते हैं, शुरू करते हैं आज का ये वीडियो। सो कीप वॉचिंग गाइस, देयर विल बी सम काइंड ऑफ photo session, and there will be some kind of discussion about the melasma and the pigmentation. So keep watching. One of our speaker, Dr. Deepak Parikh sir, will discuss very nicely about how the pigmentation occurs and all.
Okay, so to commence the academic session, then I'd like to invite Dr. Deepak Parikh sir to say a few words on the topic.
It's not few words, it's 30 minutes. So, involving the back of the ear, which is spared in melasma, spared in LPP. So, if you have hair dye-induced pigmentary changes, you need to know and you need to tell them that avoid hair dye and avoid sun. And there comes the big fight. I don't know how many of you, but it's a big problem if you have a white hair. Nobody likes to have a white hair, which according to me is a blessing in our profession. Knowledge नहीं भी है तो बाल थोड़े सफेद है तो पेशेंट को लगता है डॉक्टर बूढ़ा है, उसको कुछ तो नॉलेज होगा. Okay, so certain professions benefit from the white hair. So they will ask you next question. मेहंदी यूज कर सकते हैं क्या? So what do you reply? Yeah? What is मेहंदी? Henna. What is henna? Do you get black henna? So बाजार में ब्लैक मेहंदी मिलती है, वो मेहंदी नहीं है, वो केमिकल ही है. ओके, क्योंकि ऊपर वाला ब्लैक मेहंदी नहीं बना. Be very clear. What you are getting is simple chemical. If you use the true मेहंदी, that means मेहंदी के पत्ते लाओ, चूटो, पीसो, लगाओ, तो कैसा कलर देगा? Brownish. Alright, it doesn't give you black. So these are some of the triggers which you need to avoid. Avoid sun. We are not discussing sunscreen, so I won't go into it. Inhibition of melanin synthesis and removal of the melanin pigment. Okay, that's the last thing which we won't be able to discuss. That is lasers. That's what the answer we all want to know, and that's where the sunscreen are important to avoid the sun. Now, sunscreens, there is a lot of discussion about it. I won't go more into it. I know they have a product which has a sunscreen, but somehow or the other I have found that when you use a fixed product with sunscreen, the only disadvantage is the product is applied in this quantity. So even sunscreen gets applied in smaller quantity. Whereas we know sunscreen requires larger quantity. So it may not truly protect, and it should not give a pseudo protection. Alright. Otherwise sunscreens are good and you can use it if used correctly. Alright, so that's what I tell my patients. You can use sunscreen, but I'll tell you how to use it. Which is the best sunscreen? There are only two good best sunscreens in the world. Cheap, effective, available everywhere in the world. Burkha and umbrella. Best way of you protecting yourself from the sun, and it really helps you. Okay, so now we come to the pigment lighting agents. Sorry, we started. Okay. So you need a few of the pigment lighting agents. So here are some of them, and as I told you, some are wishful thinking, some are too scientifically used sun protective agents.
So this is a dermatology CME. So the professors were discussing about the melasma, and in between there was photo clicking sessions. So अंत तक देखते रहिए आप लोग, लास्ट में और भी डिस्कशंस हैं, मतलब मेलाज्मा के बारे में, फिर कैसे पिगमेंटेशन को हम लोग ख़त्म कर सकते हैं, या फिर परमानेंट पिगमेंटेशन क्या होता है, मतलब मैकेनिज्म ऑफ एक्शन ऑफ फ्यू ड्रग्स, एवरीथिंग सर ने बहुत अच्छे से समझाया है। ब्लॉगिंग कर रही थी बीच बीच में, तो देखते रहिए लास्ट অঁ মোৰ নাইট আছে যাব MLR So there's 40. This is Dr. Shyamanta sir. We all know about him. We have always heard. Actually, when I was an UG student, I have always heard that there is one dermatologist, Dr. Shyamanta sir. You can consult him. I have shown you also many times. For I got a little bit vitiligo. You may have forgotten, but I remembered. So to all my viewers, I want to say that sir wants to say something to the upcoming generations who are going to be future doctors. So, sir, please.
Thank you, and I wish that a lot of you is interested in dermatology. After all, you know, this is a specialty that deals with the largest organ of our body, that is the skin, and of course with its appendages, the hair and the skin and the nails. So I wish that you all attend such CMEs as you did today, and you get exposed to the common skin conditions. Even if you don't specialize in dermatology, I'm sure any specialty that you specialize in, you will come across conditions of the skin which you will need to diagnose, and even if you don't treat, you need to diagnose and refer. So in that sense, I think the knowledge of the common skin dermatosis will hold you in good stead for your future medical career. And those of you who are really interested in coming to this specialty, I urge them to please do their internship now that it is mandatory. So all of you will be posted in dermatology, you get exposed, and I'm sure some of you will be interested to, specialize here. And then our fraternity is small, we are growing. In time, definitely we will have a lot of you joining our fraternity, and I wish all of you the very best for your future NEET PG and your preparations for that. And I hope these kind of CMEs will stand you in good stead for the future. Thank you.
Thank you, sir. Thank you a lot, sir.
Field is second to none, and we'd like to have a very round applause for them. A big round of applause for them, please. I'd like to invite Dr. Shyamanta Purva, sir, our president and the Senior for Association, to commence the session. Thank you.
Respected Dr. Parik, Dr. Jadhav, Dr. Varsha, all the other members of the Development Chapter of Northeast IDVL, and departmental colleagues and students and dear friends. So it is indeed a momentous day for our chapter of any IDVL Development Chapter, that we have amidst us a person of the stature of Dr. Parik, someone who has been awe-inspiring and inspirational personality in our specialty, in our opposite specialty, and someone who I have always looked up to for inspiration, for guidance, and someone who probably has been one of the best presidents that IDVL have ever had. Besides, of course, being the youngest Secretary General of IDVL, and someone who has a doyen and an authority in the field of pediatric dermatology. So it's indeed a pleasure and a privilege to have you amidst us. Welcome to the program. We also have amidst us Dr. Rajesh Jadhav, who is a consultant dermatologist at Thane and an acquaintance of several years. So it is indeed nice to have you amidst us. And we also welcome Dr. Varsha Parekh, consultant dermatologist at Mumbai and the better half of Dr. Deepak Parekh. Welcome, madam. And without further ado, I think the day is meant to garner as much as possible of the pearls and pebbles from our two experts.
And everybody goes on asking at least 3 times a day, morning, after bath, evening, before going to bed. The question that remains is everybody wants the same answer. And today, the competitive world has made us that look good industry is definitely pushing it because it's being heavily marketed. This has made a lot of people very conscious about their look. And when the looks are looked at, there are many different aspects that we look for. And one of them is pigmentation. The moment a patient comes with a pigmentation like this, you are taken aback in social world, in your professional world. So your progress is hampered, your confidence to deal with your competitors, your surroundings, your other colleagues goes down. So all this affects the human being. And this necessitates us to treat the pigmentation. Alright? So the first thing that we have to know is with plethora of depigmenting agents available, what is science, what is non-science, what is marketing, what is true science. So Joe Dine, one of the pioneers in the field of cosmetology, had a wonderful lecture in AED, and there she had discussed what wishful thinking. So 99% of the time, industry brings the product with this wishful thinking. Okay, it will work like this. Does it really work or not? God alone knows. Alright? So this wishful thinking is at one end, and scientifically really useful is at another end. So most of the products which you get in the market are wishful thinking products. And you as a clinician need to know what I am using and why I am using it. So let's discuss today in brief the medical treatment. I am not a cosmetologist, I don't do lasers, so I won't be able to talk to you about chemical peels and other things. I am going to stick to you today discussing medical. Most important point first is for you to know, is this pigmentation acquired or congenital? I mean, if somebody comes with acropigmentation of DOE or poikiloderma or nevus of Ito, you can't do anything. You will have to simply say, sorry, I can't do anything. Now comes the next. Patient says, 2 mahine pehle hua, 3 mahine pehle hua. Then, what parameters do you take into consideration before you decide what line of treatment you want to use? Anybody? What do you do? What goes through your mind?
Any recent trauma.
So you are looking at etiology. Okay. Anything else that goes in your mind? Which is of the importance in treating pigmentary disorder? Level. Where is this pigmentary problem? Is it in only simply epidermal? Or is it at dermoepidermal junction? Or it's already gone into the dermis, superficial dermis? Now, which drug works on superficial dermis? Melasma. Melasma. None. So if I am going to treat post-inflammatory hyperpigmentation of lichen planus with depigmentary agent, it's ridiculous. It's not going to work. So when a patient comes to me with facial pigmentation, the commonest cause other than melasma is LPP, lichen planus pigmentosus. Now when I say it is LPP, pigment is already dropped down. Now giving them topical drugs, will it work or not? If it will work, at what level will it work? So as a clinician, the first is to find out where is the problem for the pigmentation, hyperpigmentation. It's purely epidermal, like tinea versicolor with brine pigmentation, which is purely epidermal, and you treat it and it will go. Patient in tinea versicolor doesn't say I got fungus, he comes to you with pigmentary problem. Okay. Now in contrast, you take acanthosis nigricans, facial acanthosis nigricans. Where is pigment in facial acanthosis nigricans? Epidermal? You're right. There is hyperkeratosis, papillomatosis with pigmentary changes, hardly anything in dermal. Alright? So now knowing that it is hyperkeratosis, your topical retinoic acid added will work. So your topical therapeutic agent will be decided on what is the pathology. So when you decide what topical therapy to use in pigmentary disorder, first is to know etiology or to know where the pigment is. Like in LPP, in every LPP patient, most of the time they'll come and say, sir, 2 साल से 3 साल से I showed it to so many doctors, nothing has worked, I've spent so much of money. My first instinct is to do a biopsy. For 2 reasons. One, to confirm is still an active LPP. Or the disease is not active, basal cell degeneration is not seen, inflammatory infiltrate is not seen, it's only pigment incontinence. Then my treatment may not work. But if it is active disease, let me tell you, the best drug is cyclosporine. You give for 6 to 8 weeks of cyclosporine, it gives a remarkable improvement in pigmentation control of LPP. And then I will shift to topical depigmentary agents. So your therapy will decide on etiology, on the depth of pigmentation. So what are the depigmenting agents that you know? Azelaic acid, kojic acid, alpha-albutane, louder, hydroquinone. Alright, so you know few of these topical depigmenting agents. Which one you prescribe routinely? Come louder. Kojic acid. Okay. Where does kojic acid work? See, now you will have to understand, if there is going to block the pigment production, there is a melanogenesis, melanin synthesis, and your product need to know where it is going to act. Alright? So, most important is frustration. As a clinician, it is most frustrating to treat a patient who comes with LPP. It's difficult, you can't go back to original, and that's the most frustrating for any one of us. And the treatment is still most unsatisfying. And at times hardly anything to offer. So, what you need to do? Avoid the triggers. That is the first therapeutic approach. Now, what is the commonest trigger for a pigmentation?
UV exposure, sun exposure.
Sun exposure. That is the most commonest trigger for what? What does the sun do to pigment?
Increase the production.
Increases melanogenesis. Size of the melanosome. Why should we tell patient avoid sun? Tanning. What is tanning? This is most important point. I don't know. Every day in my practice, I will at least have 2 or 3 mothers who will come and say, my child wants to go for swimming, which anti-tan lotion should I apply? And how do you reply? Tanning is a God-given protective mechanism to prevent the damage to the body. Nobody on the earth can prevent tanning. There is no permanent solution, no solution. Anti-tan lotion is a big humbug marketing gimmick. Nothing else. And what happens in tanning? Tanning does not create new melanin. Tanning is actually transferring melanosomes from melanocytes to keratinocytes at a very rapid phase. And so skin darkens. So there is no increased melanogenesis in tanning. It's only shift of melanosomes from the melanocytes to the keratinocytes. And that is why you do nothing, in 4 to 6 weeks it will go, because the same epidermal cells will come up and scale off. So tanning will go away naturally in a period of 6 to 8 weeks. Alright? But there is no way you can treat tanning. You should not treat tanning. The tanning is a God-given protective mechanism. Alright? So we go back to why sun should be avoided. What does sun do to pigment? It increases melanogenesis. How? No. Yes, it does help you by increasing the melanogenesis, by increasing tyrosinase activity. Okay, so that is how the sun tends to act. The UV light in the sun tends to act. The second thing it does is it penetrates deeper down. So your pigment which was lying at dermoepidermal junction will also start dropping down. So what was treatable becomes untreatable because you don't have anything for any pigment which is melanosomes in the dermis. Dermal melanocytes or phagomelanocytes, there is no drug which works on melanogenesis is going to work. So neither your hydroquinone, neither your albutin, neither your kojic acid is going to work if the melanin is in the dermis. Alright, so that is very important. The most second important is, what is the etiology of melasma? There are a lot of etiological agents, but one of the etiological agents believed is photocontact dermatitis. 2, fragrances, scents, perfumes, colognes, deos. Okay, so to avoid postulated photocontact dermatitis, you need to avoid sun. The third commonest cause of pigmentation on the face in a female mostly than in a male is contact dermatitis due to hair dye. The commonest. And how does it start? Patient will start.
सो अंत तक देखने के लिए आप सभी को बहुत बहुत धन्यवाद। और अगर आप लोगों को ये वीडियो अच्छा लगा तो मेरे इस चैनल को सब्सक्राइब कर दीजिएगा।